Assalamu alaikum. Welcome back to my channel. Today I have a very interesting case of prosthetic mitral valve obstruction, or in broad terms, it's a malfunctioning mitral prosthesis. Now, the first question is this: what is the malfunctioning prosthesis? Is a malfunctioning prosthesis valve refers to a heart valve replacement, either mechanical or bioprosthesis that isn't working properly, leading to abnormal blood flow or pressure changes in the heart. This is very necessary to evaluate the malfunctioning mitral prosthesis because it becomes dangerous or even life-threatening if not identified and treated early. And now the second question is very every problem in the heart has a cause. Now what is the cause of this malfunctioning mitral prosthesis? Now I will tell you the causes of its malfunctioning and how to evaluate this on echo. There are several reasons. Number one, thrombosis, clot formation. Is there may be a clot formations? The blood clots from the valve, especially in the mechanical valve. So this is in this case there is a mechanical valve which can impair leaflet motions, restrict the opening closing, and leads into the stuck valve. Number second is infective endocarditis. uh, which can cause vegetations, abscess, and dehiscence or leaflet destructions. But in this case, we are not visualize any vegetations here. Number third, mechanical dysfunction, in which leaflet or disc are stuck or fractured, mainly seen in the older mechanical valve. Number four, penis formation, the overgrowth of the fibrous tissues around the valve, which can interfere with the valve motions similar to thrombosis but an older prosthesis. Now, these above are the causes of malfunctioning prosthesis. Now we have multiple tools for diagnosing malfunctioning prosthesis, but we will talk about the echo only. There is multiple Doppler parameters which is I use for assessment of the prosthetic valve. These parameters I use for the prosthetic mitral valve functioning. The number one is the peak velocity. Normal is less than 1.9 meter per second. Possible stenosis 1.9 to 2.5, and significant stenosis greater than or equal than 2.5. As well as the mean gradients less than 5 is normal and greater than 10 is significant stenosis. The VTI ratio, or we call it DVI, uh, in which the prosthetic mitral valve VTI divided into the VTI of the LVOT. So less than 2.2 is normal and greater than 2.5 is significant stenosis. Effective orifice area is greater than 2.5 is normal and less than 1.0 is significant stenosis, and also the pressure half time is less than 130 is normal and greater than 200 is a uh, significant stenosis. So let's watch what is in this case we have the Doppler's parameters. What is the velocity, the mean gradients, the DVI, and the effective orifice area, and the pressure half time. We see in the look at in this patient. In this case, the velocity is 2.64 meter per second, and the elevated velocity and gradient. The velocity less than 1.9 meter per second is normal. here we have 2.6, and the gradients is less than 5 is millimeter of mercury is normal, but here we have the mean gradient is 19.8 millimeter of mercury. So now from these parameters we sure that there is something abnormal. The elevated velocity and gradients, there is something abnormal is that there is a high flow, functional stenosis, or patient prosthesis mismatch, or pathological stenosis. So for the more confirmation and rule out, we will look for pressure half time, DVI or VTI ratio, and effective orifice area which can help for pathological stenosis. The pressure half time is less than 130 is normal, but here we have 213 meter per milliseconds pressure half time. No, it's more suspicious for pathological stenosis. No VA, TEC, DVI, and effective orifice area. For the DVI, we have need two parameters. One is mitral prosthetic VTI, and second is LVOT VTI. We divided the prosthetic VTI into the LVOT VTI. Here is the 73.6 centimeter. This is the mitral prosthetic VTI, and this is the LVOT VTI 16.7 centimeter. So the prosthetic 73.6 VTI divide into the LVOT 16.7 DVI VTI is equal to the 4.4 dvi. So in the normal dvi is the less than 2.2, and above the 2.5 is abnormal. So this is 4.4. So this is also the significant stenosis of the prosthetic vein. Now the final parameter is effective orifice area. The same method of continuity equation, we will find the effective orifice area in centimeter square. For this method, we take the LVOT area and VTI from which we get the stroke volume, and then the mitral prosthetic VTI. So this is also the LVOT VTI we have, and we take also the prosthetic VTI. Now we only take one thing more, which is the LVOT diameters. So here is the LVOT diameter 1.8 centimeter. So put it in formula and you will find that the effective orifice area of this patient is 0.57 centimeter square, and the abnormal orifice area is less than 1.2 centimeter square. So the result is have a significant malfunctioning mitral prosthesis, because all of the parameters, the velocity, the mean gradients, the pressure half time, dvi, and the effective orifice area all are elevated and decrease the area. So look how easy to evaluate the malfunctioning prosthesis mitral valve in echo. Whenever a patient came to you with prosthetic valve, apply these parameters to rule out it is a normal prosthesis or a malfunctioning. Thank you for watching the video. Like subscribe the channel and like the videos. Thank you.